Our first speaker will be Nicole East. She received a PharmD from Northeastern University. She completed her first year of postgraduate residency at Shore Medical Center in Somers Point, New Jersey, and currently is a second-year pharmacy resident at Rutgers University with a specialty in psychiatry.
Thank you. Good afternoon, everyone. Set it up here. So my name's Nicole and I'm a pharmacist, and I'm going to be talking to you today about managing medications in the elderly population. And I believe you have the slide set in front of you. So are you part of the silver tsunami? What do I mean by that? The silver tsunami, so the baby boomers are hitting retirement age. It is estimated that the US population that is greater than 65 years old will double from 2010 to 2050. In 2011 alone, 7,000 people turned 65 years old every day. So what does this mean for healthcare? So this is the outline, and we'll be going through each point. So older adults and the use of healthcare. As you age, you tend to use more healthcare services, and in this day and age, physicians like to specialize, and as of right now, there are less trained geriatricians, fellowship trained geriatricians, but more people needing the healthcare services from them. So what can medications do? Medications treat and cure certain disease states, which is why many patients are on medications. So a little statistics here. 91% of adults 57 through 85 years old regularly use at least one medication, and 81% of these patients use at least one prescription medication. 50% of older adults use at least 5 medications, and a third of these adults are 75 years of age or older. Women less than 75 years old use more medications than men because naturally women like to use healthcare services more. And as people age, they use more medications and supplements. So what else can medications do? So just as much as medications can treat or cure diseases, they can also cause harm. So harmful side effects happen twice as frequently in adults greater than 65 years old versus less than 65 years old. And these side effects in the elderly cause the largest number of ED visits for unintentional injury of any age group. It's about 7 times more likely for an elderly person to be sent to the ER due to a side effect of a medication versus the general population. And these side effects are more likely to cause the patient to be hospitalized. Older adults are more sensitive to medications. So what do I mean by that? So here's some science. When you start off from when you're a baby, we like to call babies in the pharmacy world little water balls because we have to take that into consideration when dosing their medications. But as the older you get, the more water you lose. And so physiologically, that's going to cause a higher percentage of body fat. So lots of medications are either water soluble or fat soluble. If they're water soluble, then the blood levels may increase in an elderly person's body. And if it's fat soluble, they like to deposit and hang out longer in your body, which puts you more at risk for side effects. Less protein in their blood, which can also cause an increased drug level. The liver and kidneys are less active. A lot of medications use the liver and the kidneys to excrete from the body. And some drug receptors are more sensitive and some are less sensitive. So these are just some bullet points that put you at higher risk for harm from medications. So if you take 5 medications or more and 12 doses per day, if you take any of the following drugs, these are drugs that have a narrow therapeutic window. So what that means is where they work and where they're toxic are very close in range. If you use more than one prescriber or pharmacy, have at least 4 medication changes per year, take medications for more than 3 conditions, have someone bring medications to your house, find it difficult to follow the regimen or choose not to, or don't know why I'm taking each of my medicines. So knowledge is power. Knowing why you're on medications and what you're taking it for is very important, and it's important for you to be part of your healthcare. So some symptoms that you can look out for taking medications are confusion, falls, drowsiness, dizziness. These are all symptoms that could be caused by your medications or could be a bigger underlying condition, and it could be something that you should speak to your pharmacist about or doctor. Know the common pitfalls. So measuring liquids. What do you use to measure your liquids? Do you use a teaspoon to measure a teaspoon? Knowing the difference between a teaspoon and a tablespoon. Usually we recommend the measuring devices, so like the little cups that tell you how much you're taking. Reading the labels on the bottle, so what are you taking, why are you taking it, and taking the medications at the right time. If you're going to take a medication that's going to make you drowsy or sleepy, you don't want to take it before your 8-hour workday. Create a personalized medication record. So a personalized medication record, or a PMR, is an up-to-date list of all your prescription and non-prescription medications, including the dosing schedule. You should keep this with you at all times and bring it to the doctor, hospital, or pharmacy. This helps us a lot when you come into the hospital and you have an up-to-date list of medications so we can give you what you're supposed to be on. There's a website listed there that gives you access to the documents that I'm about to show you, and it's basically a document to create a personalized medication record. So the first page is just information about yourself, your emergency contact, who your physician is, your allergies, and any side effects to medications that you've been experiencing or have experienced in the past. And then the next sheet is your medication record. So as you can see, it lists out each block has either the name of your drug, the dose, the reason for why you take it, when you take it, when you started it, when you stopped, and who prescribed it for you. Ask the right questions. So what is the brand and generic name of your medication, and what is it for? How will you know if it's working? What are the possible side effects and drug interactions that I should know about? This is really important to take control of your own healthcare, and there's people that can help you, like your local pharmacist or your physician. Know the prescription label. So every prescription label is going to have the phone number for the pharmacy. If you're having a side effect to a medication, this is something that you want to keep handy. What is the medication? How many times a day do you take this medication? Sometimes it's helpful to write the number on the top of your prescription bottles, and how many refills are left. This is an important one because sometimes patients let the refills run out, and then that delays your treatment if you don't have any refills left and you go to refill your prescription. So this is important. Give your doctor and the pharmacist the right information. So this is why it's important to keep the personalized medication record so that you're keeping track of your own healthcare only for us to serve you better. So take note if there are any changes to your medications, if you have any new medications, stop medications, or change doses. Note any symptoms you're experiencing because like I said before, this could be due to the medication itself, or it could be a bigger problem that your doctor needs to investigate more into. And the last bullet point is, I feel as a pharmacist, the most important, is including any non-prescription medications you take, including vitamins, herbals, supplements, and homeopathic remedies. Like Leslie said, when I did my first year residency at my last hospital, I spent a lot of time in the emergency room helping out, and this was a huge one that I saw. What patients don't realize is that herbal medications can interact a lot with prescription medications. So if this is something that you would be interested in, I'm not saying don't use them, but I am saying speak to a healthcare provider before taking something, because there might be an interaction with your blood pressure medication or your blood thinner medication, which is probably one of the biggest things I saw in the emergency room is the herbals a lot of them are natural anticoagulants, so they naturally thin your blood. And if you're on a blood thinner and then taking an herbal medication that does this, it's going to cause a bleed and it's going to send you to the ER. So this is a really important bullet point to remember. At the pharmacy, ask your pharmacist for advice on over-the-counter medications, herbals, and dietary supplements, and use one pharmacy for all your prescriptions if possible. I know it's hard this day and age with mail order and all the CVS and Walgreens that are right around the corner, but it's really important if you don't use one pharmacy to keep a list of all your up-to-date medications so we can really evaluate your regimen next to whatever it is you want to be using. Read the drug facts labels. So if you do want to take an over-the-counter medication, it's important to know what you're taking it for. So will this medication help a cough? Will it relieve sinus congestion? How many tablets can I take in a 24-hour period? Knowing the maximum of whatever it is over the counter that you're taking. Can you take extra strength Tylenol with this medication? Acetaminophen is in a lot of combination products. Acetaminophen is the generic name for Tylenol. So when patients are looking at over-the-counter products, sometimes they forget because the names can be deceiving. I believe Theraflu is over-the-counter, and a lot of patients like that this time of year. That's all acetaminophen. So it's important to read the drug labels and know what you're taking and to make sure that you're not doubling up or mega dosing yourself. What do healthcare providers do? Well, what we do is we review all the medications and make sure they are appropriate for you. We use different criteria, specifically in the elderly. There's something called the Beers criteria. It's not FDA approved, but it is a list of medications that are recommended to not be used in the elderly due to the risk of side effects or falls, whatever it may be. And then we as pharmacists can recommend alternatives to the physicians. So what is Princeton Healthcare System doing to help me? The pharmacists review all the medication orders for older adults and work with other healthcare providers to improve drug selection and drug dosage. They also have a geriatrics pharmacist here. I just spent the month of October working with him, and he's very intelligent and he helps out a lot on the floor in making medication changes to help benefit the elderly. And Project Red, which I don't personally work with, but I believe it's to enhance communication between transitions of care. So going from one facility to the next, whether it's a nursing home to the hospital or the hospital to rehab. So thank you for listening. Right now, I'll open up the floor to any questions.
What is ED stand for?
What does what?
ED.
Oh, emergency department.
Oh,
I'm sorry.
not ER.
All the same thing.
I thought so.
Yes.
So you mentioned that the most common things used is people taking emergency room, coming in, taking herbal medicine and anticoagulants. Have you seen in your experiences for in Korean community or in Asian community, what other herbal medicine complication or any other medication complication you've seen that more often that as a Korean community to be aware of?
I haven't specifically been able to work in a hospital that has a big Korean community with it, but I can tell you the one thing that I did see a lot was ginkgo biloba. So I don't know if if that's something that people use here, but that is a natural blood thinner. St. John's wort, that has a lot of drug interactions beyond the blood thinning. And a new one that I just recently saw are chia seeds, which I didn't even know what it was, but there was a patient here who came in. She was on warfarin, which is an anticoagulant, and she had an INR of 10, and we look for an INR of 2 to 3. So it was very elevated, and actually I was just walking in the local Sam's Club, and they were giving out free samples of it, and I actually told the woman, I said, I just had a patient, and this is a natural blood thinner, and you really need to tell people if they're on a blood thinner, then this can cause their blood to thin out even more. And she wrote it down, and she was happy that I stopped and told her. So. Any other questions?
I have a twofold question. One is that nowadays there are so many patients that actually take several different types of medications prescribed by different specialties.
Right.
And I would imagine there are some interactions between the medications. So who is in charge for looking into what each patient takes and take care of those problems? And the second question would be, is now because of the how the medical insurance is, quite a few large number of patients do take the medication from large companies like get the prescription from Medco's and those,
Right.
which is bill or internet companies. And where does pharmacists stand? Because they're not really looking into. I'm not even sure some pharmacists are involved in dispensing these medications because they're just being dispensed, rather than they are looking into what medication is interacting with another medication.
Yes, so there are pharmacists that sit behind the scenes and do dispense mail order. There are mail order pharmacists that it would be like going to a CVS, they just work where you can't see them. And as far as drug interactions, I feel that that's part of our job as pharmacists to check against someone's profile. So whenever we get a prescription and enter it into the system, the computer system kind of flags us if there is a drug interaction, and then as a pharmacist, we make the determination based on our clinical judgment. Is this something that I need to call the doctor and get them to switch, or is it something that I just need to educate the patient about? But anywhere that a prescription is coming from or that a patient is getting dispensed a prescription, a pharmacist always has to check that prescription, and there is someone behind the scenes doing it with the computer program that checks the interactions. The only downfall is that if you are using a CVS or a mail order pharmacy, their computer systems don't always check the drug interactions. So that's the only downfall with it. But normally the insurance companies will pick up on like a therapeutic duplication. So if you're taking the same type of medication, your insurance company won't let the other one go through if you're already on something for that indication. Yes?
Would you display your email address once more?
Sure. It should be on the slides too. It should be on the first slide. I think I put it there.
Yeah, I got it.
You got it? Okay. And that's an L in the middle of my name. Yes?
Is there any relationship between ginseng and blood pressure medication?
Yeah. No, I don't think there's an interaction with blood pressure medication, but that is actually another blood thinner, a natural blood thinner, but not specifically with blood pressure medication. Yes.
I was wondering, since certain herbal medications, as you mentioned, have an effect, a similar effect to medications, and I remember my father had read that grapefruit juice changed the potency of certain medications, and he wanted to cut down on them.
Right.
So he was trying to kind of, it ended up not working, like he wanted to see if he could lower it by taking grapefruit juice. Are these things that, especially herbal medications, that some pharmacists and physicians now are suggesting you take them, or are they suggesting you don't take them? You know, because it seems that if you could take some kind of natural herb instead of medication, that might actually be better.
Right, so naturally, as a pharmacist, we don't like herbal supplements, and specifically because they're not FDA approved, they're not regulated by the FDA. So when you're buying something over the counter in a supplement form, I don't know what you're taking. You don't know what you're taking. Just because it says on the label that it's something doesn't necessarily mean that it's that something. And there's no evidence to support taking these medications. Some literature supports certain things, but as a whole, there's no good evidence or good literature to support a natural product versus an FDA-approved product, because the literature supports the FDA product and it goes through so many phases to get approved for these indications versus the natural. It's just the literature is not strong. Yes.
Yeah, when usually, the doctor says take a medication once a day, and, we are not sure, we should take it in the morning. A lot of people are asking, in the morning, lunch, or after, or with the medication, or with the food, or not food. Do you think, pharmacists should explain to the patients?
Yeah, of course.
If they didn't, how we, think,
I think that's definitely a pharmacist's job. That's part of our role, that's part of our training. A lot of training through school goes into counseling patients and what's an effective way of counseling. And you can't expect someone to sit and name off all the side effects that come along with medications, because we all know here that medications have a ton of side effects, but the important ones. What should your patients be looking out for? When should they be taking it? Or at least asking you, do you know how you're supposed to take this medication? And if you have any questions specifically, then I most definitely think that that's a pharmacist's job.
So how about, some patients take a lot of, medication together.
Mm-hmm.
So once a day, so do you think it's safe, all of medication together, like 3-4 different kind of medication?
So if you're going to one pharmacy where that one pharmacist can evaluate everything you're taking, and your pharmacist doesn't specifically say to you, there's a drug interaction, you should separate these, or there's a drug interaction, I called your physician to change it, then I think that it actually would help to take all the medications together, because it's easier for a patient to remember to take them. Thank you very much.